Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
Welcome to Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. They're in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro, offering free screenings for the next 2 weeks. We'll give you numbers to call to take advantage of that offer. Tonight during our program, we're going to be talking about shoulder injuries and knee injuries. Call me crazy, but that seems to be two areas of the body where they're frequently breaking down, the shoulder and knee. If you have questions about a problem you're having, you can call us toll-free. Our number is 1-888-634-7488. Answering your calls tonight, we're pleased to have Dr. Merrick Wetzler. He's an orthopedic surgeon with South Jersey Orthopedic Associates. They're located in Washington Township and Voorhees. Next to him, Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Again, our toll-free numbers, we talk about knees and shoulders, 1-888-634-7488. While we're waiting for your calls, Dave, why don't you show us the anatomy of the shoulder joint?
Sure. Give a brief anatomy of the shoulder. This is the right shoulder. This is the humerus. This is the head of the humerus right here. This is the clavicle, known as collarbone. All right. This is the scapula. This is the AC joint here, acromion-clavicular. This is the acromion process. This is the coracoid process. All right, that's the bones here. Let's do a little bit of muscles. We're talking a little bit of rotator cuff tonight. This is the front of this is the front here. This is the up here is the supraspinatus, subscapularis. Turn around, infraspinatus, and teres minor right here. That's the major 5 muscles of the rotator cuff.
And Dave mentioned the rotator cuff. Let's just jump right on that, Dr. Wetzler. You hear so many problems with rotator cuffs. What is the rotator cuff? Why is it so important?
Well, the shoulder does not have a lot of inherent stability. It has the greatest range of motion of any joint in the body, and the rotator cuff, because there's no inherent or static stability, you require dynamic stability, and that's what the rotator cuff comes in. The muscles of the rotator cuff actually suck the humeral head into the joint and keep it located in the joint and with maximal contact throughout the range of motion. And the supraspinatus muscle, which is here, and the subscapularis muscle, which is here, are important stabilizers of the joint. They're small muscles of the joint, and therefore they fatigue easily. And they're called on to do a lot through the full range of motion of the joint, through normal daily activities and exercises. And due to that, there's a lot of wear and tear of them, and they can break down. Now, in here, if you look at this shoulder here, there's this thing called the coracoacromial arch, which goes from the coracoid to the acromion, and this is the coracoacromial ligament. The rotator cuff has to pass through this. The rotator cuff, or the supraspinatus tendon, mostly, gets pinched on that. And what happens is it gets inflamed. This is a finite space, so by getting inflamed, what happens is that the tendon gets thicker. By getting thicker, it pinches more. By pinching more, it gets more inflamed. So you get this positive feedback loop. And by what happens is that over time, the rotator cuff gets fibrosed or scarred. Therefore, no matter what we do, it will not get smaller, so it constantly pinches. If we keep pinching it and so forth, then the rotator cuff will tear. That's the wear and tear type injury to the rotator cuff. The other type of rotator cuff is like with Chad Pennington for the New York Giants and a couple other pro athletes. They fall, they get thrown down on it, and they tear the rotator cuff that way.
All right, Dave, what are the more common rotator cuff injuries that you see?
Well, as Dr. Wetzler nicely talked about, the most common one we see is supraspinatus tendonitis, and that's like we say right here. The supraspinatus comes right through this tendon here, comes right through this arch here, and it becomes impinged. And over again, in repetitive activities, this area will become very inflamed. I think that's probably because you see a lot more with jobs. You see a lot of these people laying people off, and they're having one person do the job of 2 people. And when things like electricians, contractors, people to put in the ceilings, drywallers. I mean, they do a lot of overhead activity, and they're doing a job of 2 people and doing repetitive overhead activities. It can cause that to become inflamed and cause a problem.
All right, we are talking shoulder injuries. We're also talking knee injuries, and we're also taking your phone calls about those. Our toll-free number is 1-888-634-7488. Let's take our first caller, Dave from Bridgeport, Pennsylvania. You're on Sports Doctor. Dave, what's your question for us tonight?
How you guys doing? I had a torn rotator cuff, and I had surgery done a year ago. I had orthoscopic surgery done, and I've done much better now than I was back then. I can start doing some push-ups, and I can throw a ball back again. But there's still some pain in the not the shoulder, but like towards the outside of my muscle of my arm, and I was told that pain transmits down there. Am I eventually ever going to be completely pain-free from this?
All right. Does that go away?
It's hard to say. I mean, there's a lot of structures in the shoulder joint that can result in that pain. It could be some arthritis in your AC joint. It could be that you have some tendinitis in the other parts of the rotator cuff. It could be, even though your rotator cuff was repaired, it's still, still a muscle, still results in soreness when you overuse it. If you go and do something that you haven't done in a while, your muscles will be sore no matter if I fix your rotator cuff or not. So it's hard to say whether you ever be pain-free. I mean, you're better off than you were. So at this point, you should continue to make improvement. And if you stay on a good exercise program, I think that you will get better over time.
Dave, is therapy important for someone like that?
As Dr. Nicey said, I think the joint works dynamically, so everything needs to work together. And the muscles around the joint really need to work together. And if you have one muscle that's stronger than the other, and it could cause the dynamics of the shoulder not working properly. So you really take advantage of the free screening so we can at least take a look at you and see maybe what's going on. It's kind of hard for the doctor to tell you what's going on through the phone lines. But if we take advantage of your free evaluation, or screening, I should say, and maybe we can give you an idea. It even could be your deltoid, which is the muscles on the outside of your arm. Maybe you're doing something wrong with that, and it's making that to become tight.
And we will put the numbers up for the screenings in just a few moments. Dr. Wetzler,
Well, one other thing that sometimes gets overlooked by many physicians is that the scapula, but only 1/3 of your motion is basically from the glenohumeral joint or your shoulder joint proper. The rest of your motion of your shoulder comes from the scapula being rotated up as well as superiorly migrating through the range of motion of the shoulder. That allows you to lift your shoulder all the way up. If the muscles of the scapula are not trained appropriately during your rehab as your rotator cuff, you can still have pain even though your rotator cuff is fixed or you rehabbed your shoulder if those muscles are not also appropriately rehabbed.
All right, our toll-free number is 1-888-634-7488. Let's talk to Chris in Philadelphia. Chris, you're on Sports Doctor. Your question for us tonight.
Hi, how you guys doing?
Good.
I was wondering, I had surgery, meniscus surgery in my right knee back in January, and apparently now they have to go back, and they said that they want to cut out a little part of it that's torn. I was just wondering, do you think that with meniscus surgery, I could probably if I could get back to around 100?
Now, did you have a repair back in January?
I'm sorry?
Did they repair the meniscus, or what did they do back in January?
Yeah, they did that, and now they say that there's...
I mean, a lot of times, the meniscus, if it's an isolated tear of the meniscus, medial or laterally, it does not have 100% success in healing. We try to repair it because it preserves the meniscus, which acts as a shock absorber, plus some other functions in the knee, increases stability and so forth. But we try to preserve it. But a lot of times, it just either doesn't have a good blood supply, or it's, you can see it arthroscopically, but you can't see it microscopically. And microscopically, there might be more damage to the meniscus than we can see. So a lot of times it doesn't heal. It's not uncommon. Now, it depends on how much meniscus they take out. You know, studies have shown that the chance of you developing arthritis down the road is proportional to the amount of meniscus you take out. So if they take out 20, 30, 40% of your meniscus, you have up to a 40% increased chance of developing arthritis in that knee. Doesn't mean you're going to develop it, but there's an increased chance.
All right, our toll-free number is 1-888-634-7488. Our next caller is from Cherry Hill. If you'll hang on the line, we'll come right back to you right after this short break. Also, I want to remind you that we're brought to you by Cross Keys Physical Therapy Sports Medicine Center. You may have heard Dave mention the free screening offer, and to take advantage of that, all you have to do is call the center nearest you. We have numbers up for the Sicklerville location, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. Call the number, make an appointment. It's as simple as that for the free screening offer. Again, you're watching Sports Doctor. We're taking a short break. We're coming back with more of your phone calls about shoulder and knee injuries. Our toll-free number, 1-888-634-7488. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
Welcome back to Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center, Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. We're taking your phone calls about shoulder and knee injuries. Our toll-free number to reach us, 1-888-634-7488. Answering your calls tonight, Dr. Merrick Wetzler. He's an orthopedic surgeon with South Jersey Orthopedic Associates. Dave Anselmo joins us too, physical therapist and owner of Cross Keys Physical Therapy. Again, dial us up, shoulder, knees, 1-888-634-7488. I believe we have Patty on the line from Cherry Hill. Patty, if you're there, go right ahead with your question on Sports Doctor.
Hi. My daughter, about 3 weeks ago, she's been having some trouble with her knees. She had gone to her doctor, and her knees have a tendency to go out, and they had gone out about maybe a month and a half, 2 months ago. And about 3 weeks ago, her entire knee just blew up. We ended up at the emergency room. They really didn't do anything. They just told her to ice it. They told her it was water on the knee. She just had an MRI. She went back to her doctor, and he said that her medial tendons, what he thinks it is her medial tendons are too long, and it's causing her patella to rotate. At this point, I know we're looking for doctors to go to, and he gave us somebody, an orthopedic surgeon, to go and talk to. But I talked to a couple of people, and at this point, she's still on crutches, and she's in a ton of pain. I don't know if they can't see anything. What's our next step?
Okay, difficult to say.
Well, I mean,
a
16-year-old with knee pain, a female, is a very common thing. The patella, it's a dynamic joint. It's a sliding joint in here. It has 6 different structures pulling in 4 different directions. You have your quad tendon, you have your lateral retinaculum, which is a tissue that holds the patella in here. You have your hamstring tendons in the back. You have your iliotibial band, which is another set of tendons. You got your medial retinaculum, and you got your quadriceps tendon. What's probably happened is that you have some maltracking of the patella, which is not uncommon in a 16-year-old. I mean, I don't know if she's had any therapy. I don't know if she's had any bracing or so forth, so it's hard to say. You know, there are a lot of, guys out there. I'm sports medicine trained. Within Virtuous System, there are 3 other guys who are sports medicine trained. you should see someone who's probably trained in sports medicine or specializes in athletes and knee injuries. So whoever you go to, I recommend that you ask if they have that qualification and so forth.
And look, we'll put Dr. Wetzler's number on the screen, which is 856-424-8866. There it is. We're talking knee and shoulder injuries. Our toll-free number, 1-888-634-7488. We've got John on the line from Flowertown. John, go right ahead with your question on Sports Doctor.
Hello?
Hi, John. Go ahead.
Yeah, my name is John.
Okay.
I had my shoulders operated. I had bilateral rotator cuff tears. Torn on in 1993. I had my right one operated on, but my supraspinatus broke again, and it's unrepairable now, so I have been told.
Okay, and
I mean, it's a difficult problem. I mean, what happens is that you go in, you try to repair the tendon, but there's an old saying one of my professors used to say, you can't make a silk purse out of a sow's ear. Like we talked about earlier, over time these tendons get degenerative. By getting degenerative means that the quality of the tissue is poor, as well as the blood supply to it and the ability to heal. So even though we can repair it, it doesn't mean it's going to heal. So that's what probably happens. Over time what happens is the tear retracts, the muscle becomes atrophied, and once this happens, it's very difficult to fix it. What happens now is that over time, when the muscle is torn, the shoulder migrates up, and actually, because of the other muscles like the deltoid, which pulls up the humeral head, the shoulder joint, because it's torn, actually rubs against the undersurface of acromion, forming a new arch so that the body can adapt and the function of the shoulder can be maintained as best as possible. So, I mean, you're in a tough situation. I have patients like that. A lot of other people have patients like that. The biggest thing to do is continue to rehab it as best you can, continue to be strong, continue to do things that make it feel better, and good luck.
John from Flowertown, thank you for the phone call. Our toll-free number, 1-888-634-7488. We're about 50-50 knee, shoulder problems this evening. We're devoting our half hour to that. We're taking your phone calls. I believe we have Keith on the line from Wilmington. Keith, go right ahead with your question on Sports Doctor.
Yeah, I had a dirt bike accident about a year ago, and I dislocated my shoulder. I had to have a slap repair done, a bank cart repair done, distal clavicle, and it's been a year, and I still have a good amount of problems with my shoulder. Went to 3 different surgeons and had kind of different opinions from each one, and just wanted to get your opinion.
Was it open or closed, done arthroscopically or done open?
Arthroscopically.
I mean, you had a lot of problems with that shoulder, so it's difficult to say what exactly is going on. I mean, you could have had damage to the articular cartilage of the shoulder joint, which can give you problems. You could have had problems done with the rotator cuff, which still can give you problems. At this point, a year out, I'd probably get a new MRI on you. And if it's still bothering you, probably need to have it scoped again and just see if there's anything that we can see and fix inside.
Difficult to say without actually seeing this patient, but Dave, any thoughts for?
Yeah, like the doctor said, actually he had 3 procedures done, really, right?
Well, yeah, I mean, what a SLAP is, it's an acronym. The long head of the biceps, which you can see right here, inserts inside, and if you can just now, inserts onto the superior glenoid rim. There's where you get the acronym. The superior, the biceps attaches to the labrum, so you got the superior, which is the S, the labrum, which is the L, and it goes from anterior to posterior, so you get the A and P. That's what you get a SLAP lesion. And where the bank cart lesion is in the front of the shoulder, where the dynamic stabilizers attach, is where the ligaments come in, and what the surgeon did was reattach the SLAP lesion, reattach the bank cart lesion. It doesn't mean that the articular surface was damaged or the rotator cuff was damaged as well. So it's difficult to say. As long as you're not having much instability, then there's not a lot. another test like an MRI would be beneficial, and possibly repeated arthroscopy.
It takes time. It takes time for something like this to rehab back too, to get better. And especially for one of the injuries, one of the surgeries, I know it takes a good 3 months just to rehab them back. And you had 3 procedures done. That's a lot to be done all at once. So it takes a little bit of time for it to heal as well.
All right, Keith. Thank you for the phone call. Our toll-free number 1-888-634-7488. Ron from Barnegat, you're our next caller. Ron, your question for us on Sports Doctor. Ron, are you there?
Hello.
Hi, Ron. How are you?
Okay, how are you?
Good.
Well, I had the bank card procedure done too, but I still had a problem with my shoulder dislocating. So I just had the Weaver Dunn procedure, and I was wondering exactly what it is and how long the time is.
Okay, you want to explain that one to us, Dr. Wetzler?
Well, it's hard to say what exactly the surgeon did. I mean, it's without doing it. Was it an open procedure?
Yes, they cut it wide open. They took about 2.5 inches of the collarbone out, and then they put cadaver tendons in.
Now, that's different from a dislocated shoulder. A Weaver, that's more of a separated shoulder when you separate your AC joint rather than dislocating your shoulder. What you're talking about is up here at the coracoacromial joint, okay? Versus, which is the AC joint, versus a Bankart, which comes off of right here. So it could have been that your pain, while you were still having pain, was more from your AC joint than from your glenohumeral joint proper.
All right, thank you for the phone call. Lots of problems with shoulders. Also taking your calls about knee injuries, too. You're watching Sports Doctor. We're brought to you by Sports Doctor, Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. Numbers are on the screen for the office near you. They're offering free screenings. To take advantage of that offer, just call and make an appointment. Our toll-free number to reach us with your questions, 1-888-634-7488. We'll talk to Larry when we come back about his shoulder and or knee, as we're talking shoulder and knee injuries tonight on Sports Doctor. Stay with us.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
I will be.
I will be. I will be.
I will be a pro.
A professional athlete.
A gold medalist.
If you want to be a pro, then train like a pro. Hi, I'm Mike Quick, and I've joined the Velocity Sports Performance Team powered by the Rothman Institute. The highest levels of competition require more power, more speed, more agility. Here at Velocity, we train athletes of all ages and skill levels in these specific areas. Come in for a free training session and see how you can maximize your potential.
Welcome back to Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. We're talking knee and shoulder injuries. If you'd like to reach us with questions about your knee or shoulder, our toll-free number is 1-888-634-7488. Answering your calls tonight, Dr. Merrick Wetzler, orthopedic surgeon with South Jersey Orthopedic Associates and also a television personality. And Dave Anselmo next to him, physical therapist and owner of Cross Keys Physical Therapy. He fills in for me when I'm sick. We've got Larry on the line from Camden. Larry, go right ahead with your question on Sports Doctor.
Okay, this is my question. The question is, I had ACL reconstruction done on last month. And it was done out of cadaver parts, and it was the ACL. But my question for the doctor is, by means of they reconstructing my ACL with Achilles tendon cadaver part, do that make the knee stronger?
Well, it's a very acceptable graft, and a cadaver, or what we call an allograft, is a very acceptable graft